Have you been injured in a motor vehicle crash, been diagnosed with whiplash, and you're still suffering? Have you wondered if chiropractic care can help? Well, don't worry, you're not alone. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, we've been managing patients with whiplash injuries for decades in our clinic. Please remember these videos are not a substitute for medical or chiropractic advice, for diagnosis, or for treatment. Seeing the wrong doctor can result in an incomplete diagnosis, incomplete treatment, and poor to no recovery. So let's talk about this topic of whiplash injuries. Now, this is a very brief video overview on whiplash, and we have other videos on our YouTube channel that go into a little bit more detail. I recommend, if this interests you or if you want to learn more, you go through those videos. So first things first, whiplash is not a diagnosis. So if you're diagnosed with whiplash, that's about as precise as being diagnosed with a sports injury. If I told you that I had a sports injury, what would you think? You would probably be thinking, well, did you dislocate your shoulder? Or did you break your ankle? Did you have a concussion? You see, the term sports injury is not precise. It doesn't tell you anything about the tissue. It doesn't tell you anything about what happened. It's the same thing with a whiplash. Whiplash is a mechanism of injury. It's not a diagnosis. So if that's all that you've been given, it's not very precise, and you probably need a precise diagnosis. In a motor vehicle crash, the forces that go into the body result in rapid twisting, shearing, stretching, tearing that happens almost instantaneously across multiple tissues, and it requires a very thorough diagnosis. So when we see a patient that comes in, we don't just start with treatment. We start with an exam, because the tissues that are injured need to be identified, and then and only then can appropriate treatment be delivered. You know, most people are concerned that if they go in that they're going to hurt worse than they already do, and that's a valid concern. At our clinic, we don't do it that way. The first thing that we do is we start with listening to you. We hear your story, we listen to your pain patterns, your symptoms, what makes it feel better, what makes it feel worse. We then do a physical exam. It's comprehensive, evidence-based, and we try and identify the tissues that are damaged. Oftentimes, we need to order imaging. X-rays, MRI, CT scan, or any combination is needed to identify what's going on underneath the surface. And only when we come up with a diagnosis can we come up with a treatment plan. You see, I've got a sample model here of the human body. There are a lot of different tissues just between these two bones right here. There's the disc. If I turn this around, these bumps right here, the bumps you feel on the backside, these are bones, muscles attached to these. Here's an example of some of the muscles that attach. Muscles can be damaged. Bones can be damaged. Bones can crack. They can get bruised. The disc can be injured. These are the joints. This is an inflamed joint. This right here is a healthy joint. We have nerve endings. All of those tissues need to be evaluated in order to come up with an appropriate diagnosis. Following an appropriate diagnosis, we can put together a treatment plan. Chiropractic care can help, but chiropractic care helps best when you have an appropriate diagnosis, the appropriate imaging, and the right team put together, because a lot of times patients don't get better with only chiropractic care. There needs to be other providers, other specialists brought in to help the patient fully recover to the greatest extent possible. I hope you found this video helpful. I hope you found it encouraging. If you've been injured, we are more than happy to do an evaluation to identify what injuries are actually underneath the surface and what can be done to turn your life around and to make your day better. You have a lot of videos to pick from. I'm honored that you chose this one. Please give us a call if you've been injured. We'd be more than happy to evaluate you. And until we meet again, have a blessed day.